Hey everybody, thanks for joining me today, Dr. Ross Marcagiani, with another great conversation with our word of the week. Now, this word of the week is going to be a little bit longer. I know I'm long-winded as is, but I'm getting a lot of requests for people wanting to see my video or my presentation that I'll be giving tonight at Nickel Mine in person. And because of the technology or the difficulty in technology, I'm not going to do a video there, so I'll do it now. So this will be basically an abridged version to my talk that will be in Nickel Mine tonight. So that being said, the talk is going to be about arthritis and inflammation. So we're going to be talking about arthritis here. I gave a video on this about a month ago. This will be similar, but again, we're going to add a little bit more detail to it and go into a little bit more detail. So again, this will be a more long-winded version. If you prefer to go back to our YouTube page and look at older posts, you'll see this video that will be a little bit shorter. So anyways, here we go. We'll get started here. We'll be talking about rheumatoid arthritis will be the main topic of discussion, and then we'll differ that, show how it differs between osteoarthritis, because that's probably one of the other more common arthropathies. We'll talk about what RA is. We'll talk about some testing, and we'll talk about how we want to improve the immune system here, or how to address the immune system, because at its core, the arthritis is an autoimmune condition, and at its core, it's dysregulation or dysfunction of the immune system. And typically, rheumatologists' goal is to shut down the immune system and help down-regulate that inflammation. Typically, down-regulating the inflammation by high-dose prednisone, and then using some type of biologic like methotrexate to shut down or down-regulate that immune system. Our approach here is to modulate and regulate the immune system, remove some of the aspects that could be irritating in causing a hypervigilant immune system, into using some more natural remedies other than prednisone, which can have a lot of deleterious effects, whether it's creating a lot of eye conditions, macular degeneration, cataracts, creating issues with the kidneys, creating issues or further perpetuating autoimmune conditions such as diabetes. The list goes on with long-term use of prednisone. So we'll be diving into that. Again, this will be a little bit of a long-winded video, so if you prefer something a little short and sweet and concise, please go to the YouTube page, the Turnpaugh Health and Wellness YouTube page, and look at my earlier video of the word of the week for arthritis. So let's dive in here. So again, the big difference here is rheumatoid arthritis versus osteoarthritis. The reason why I specifically chose these two is because, again, they're the most common arthropathies, or most commonly seen. Now, we do have other arthropathies or other conditions that can affect the joint. And we can see here systemic lupus erythematosus, ankylosing spondylitis. Typically with ankylosing spondylitis, the condition is less likely, but you can do an HLA-B27 test, which again, it's a little bit more on the rare side, but is connected with ankylosing spondylitis. Again, that's HLA-B27, and it does represent similar to the same symptoms as RA, so that's something to be aware. Polymyositis, dermatomyositis, scleroderma, gout, fibromyalgia, psoriatic arthritis, other conditions with joint issues and present with immune dysregulation. So what is the big difference here to rheumatoid and osteoarthritis? So we can see here osteoarthritis is typically more later in lifespan, so more evident in the elderly. It likes to stay more central, so think more of the spine, right? It will affect some of the hands, but mainly it'll affect the dips, the distal interphalanges, which is basically the further down on the fingers with osteoarthritis. And again, it is typically slower in progression and will affect more of the elderly. Rheumatoid arthritis can vary in age. Typically, you'll see it earlier on, and it will be more commonly noticed as bilateral issues here. So looking at both sides of the body and it being symmetrical, meaning both sides of the body here, rather OA more central, more along the spine, RA both sides of the body, and is typically seen to develop earlier on in lifespan rather than later in lifespan with osteoarthritis. Important to just talk about here, fibromyalgia is typically a head scratcher when we're talking about all of these autoimmune conditions because there's really no specific test for fibromyalgia. It's typically an exclusion of diagnosis. So basically you rule out various conditions and then you get to the end and match all of these symptoms up with no true blood work or imaging study, and that kind of indicates our fibromyalgia. Some typical fibromyalgia points, again, this is bilateral. This is not supposed to be meant about fibromyalgia, but I wanted to give you some quick information that it's bilateral, and it typically involves anywhere from 11 to 18 specific points. So bilaterally at the base of the skull, bilaterally at the base of the neck, bilaterally at the top of the traps, the top of your shoulder muscles, bilaterally at the center of your scapula, that's your shoulder blade, bilaterally towards the mid-back and the sternum, okay? That's the center of your chest here. And then you can typically have points bilaterally at the top of your glute, so like towards the outside of your butt cheek bilaterally, not quite at the point of sciatica. That's a little bit lower and more midline, so think like more towards the crease of your buttocks, and then also in the lumbar bilaterally. So those are common fibromyalgia points. Not that it has to fit perfectly like that, but just to be aware, you might be looking more of fibromyalgia, again, which comes back to the immune system, which we'll talk about how we want to address the immune system and support the immune system with this condition. So I just put it in here, a picture for you. Again, it allows to differentiate between osteoarthritis and rheumatoid arthritis. You can see, like we mentioned here, osteoarthritis more midline, rheumatoid arthritis more bilateral, and it's typically morning stiffness with osteoarthritis lasting more than 30 minutes, and with rheumatoid arthritis, morning stiffness, both of them lasting 30 minutes, but typically we'll see with osteoarthritis that movement is helpful, but not as helpful as rheumatoid arthritis. Movement will improve the synovium and increase fluid production in that joint. So real quick, you can see here, I want you to draw your eyes to the enhanced picture of the joint there. You can see the osteoarthritis is the loss of cartilage, right? Loss of cartilage, so that nice fluffy cloud that allows cushion for that joint, the pillow in between that joint is gone. It's eroded. And then so even if we get movement, we're really not hydrating that pillow. We're not putting fluid into that pillow to inflate, right? So movement can help, but it's not as effective. Whereas the rheumatoid arthritis, you can see in that expanded or that blown up vision of the joint there, that it's inflamed. It's inflammation around the joint. and there's still space, there's still articular space, there's still a cushion or a pillow in between those joints. And as we move, movement increases synovial fluid. So that means, think of that pillow squished, and then as we move, we inflate that pillow and we put more synovial fluid into that joint to allow for easier gliding and movement of that joint. So this is just a helpful picture. And then again, you can see, like I said, bilaterally, you can see on osteoarthritis affects more of those of the dips, the distal interphalanges versus the PIP joints with rheumatoid arthritis, proximal interphalanges. And then the big thing here with the hands, because most arthritic joints attack the hands. You're going to see with osteoarthritis, we have that thumb joint being attacked, very much of a common sign, whereas with rheumatoid arthritis, the wrist joints are affected, and in severe cases, some of the styloid process off the radius can be severely damaged and eroded on x-ray, but that's severe, that's late stage rheumatoid arthritis. So next we'll go into some testing. What would be some good testing to do here? So we want to make sure we look at HSCRP, okay, high sensitive C-reactive protein, which is a really good marker for inflammation. Your sedimentary rate is another really good marker for inflammation. It's not on here. A test that we run typically is a rheumatoid arthritis panel, which looks at three specific markers. One of them being your rheumatoid arthritis factor. But it's a really helpful test, and that's something that I run pretty frequently on susceptible rheumatoid arthritic patients. We also talked about glyc-A. This is a little bit of a deeper look at the immune system, which indicates inflammation directed from the immune system. Really great marker. We look at ferritin. This is another marker for inflammation. It's an indirect marker. When ferritin's elevated, it's an indication of something called a Fenton reaction, which basically, think of it like as if there's iron or excessive iron in your body, it tends to rust. Just like anything, if you place an apple core and you took a bite out of it and you place that apple core out in the air, it will oxidize and brown. Well, same thing if we have excessive iron, or even if we have high ferritin levels, which can become from oxidation and further rusting. So it's an indirect marker looking at inflammation here. Again, the aspect of inflammation being crucial in this condition. We also looked at something called CD57. This is a marker that looks at the immune function, more of the killing side of the immune function of the immune system. So if the immune system is overactive and overstimulating, doing excessive killing, or it also looking at the other side if it's severely underactive and it's starting to almost be burnt out to a certain degree. Another crucial marker here is looking at vitamin D. Really important that we want to assess vitamin D, and there's several studies in literature reviews posted with its connection with vitamin D and immune stabilization and its help with treating rheumatoid arthritis. We want to make sure we look at omega levels because EPA and DHA, as we're going to find out here, are crucial in helping down regulating inflammation. Helping with the regression of, or at least the prevention, the prevention of further progressing the arthritis. We also want to look at interleukin-6. You can also look at some other interleukins. These are pro-inflammatory cytokines. These are released by inflammation. The immune system releases these certain markers. Again, these interleukins or prostaglandins are released from the immune system in response to inflammation. So it gets us to a little bit of a picture of the immune system and its response to inflammation. So high interleukin-6 we know that the immune system is kind of rapidly producing a lot of pro-inflammatory cytokines in response to the inflammation. And then you can see here, like we talked about, some other inflammatory markers, the PGE2, prostaglandin E2, and your F2 isoprostanes. These are just other inflammatory markers that become upregulated in response to inflammation, and it again allows us to look at the immune system and its response to that inflammation if the immune system is hypervigilant. So, and then you can see some links here that connect the research and legitimacy behind these testing here. Next, I want to talk about some underlying issues here. So, because initially you want to ask yourself, or you should be, well, why is the immune system all of a sudden going haywire? And there are a couple things that we'll address, nutrition being number one, but also, is there some type of pathogen that is causing this issue? Is there some type of pathogen that is stimulating or causing dysregulation of the immune system? And the research that is out there, mainly done or become aware, the practitioner that made this aware was Dr. Thomas Brown, who made the connection with mycoplasm and its connection with rheumatoid arthritis. Now, I would take it a step further and say, maybe it's not just mycoplasm as well. Maybe it's some other type of pathogen that is stimulating the immune system, whether it be mycoplasm, whether it be cytomegalovirus, whether it be Lyme disease, whether it be a herpes simplex, or potentially Epstein-Barr virus. But looking at if we have a pretty significant pathogen or bacterial infection that could be perpetuating this disease here. So I think that's something to look at and make sure that we have testing for. The testing that we typically run is through medical diagnostic laboratory that assesses this and gives us pretty confident indications of antibodies, circulating antibodies to these bacteria and viruses, or potential bacteria and viruses. So something really important to look at here. And I really want to, I didn't talk about the last video, so this is the key point that you're getting, the extra tidbit is the connection here with potential pathogens. And just a little bit of information on mycoplasma. Again, I focused on this specifically because the research is really overwhelming with the support of mycoplasma. So it is a bacteria, it lacks a cell wall. The reason why I wanted to mention that is because it can create antibiotic resistance easily, which means it's really, really hard to kill. A lot of research shows the use of minocycline to kill this bacteria. I would prefer, I mean, it's always a possibility. I prefer to use natural antimicrobials and antibacterials, which we'll talk about later on here, what I would use, at least some that I would use. And then we also wanted to mention here that there are several different types of mycoplasma. The most common is the Mycoplasma pneumoniae, which can be spread through aerosolized droplets and usually represents like walking pneumonia. But there are other ways we can get various mycoplasms. They can be transferred through parasites, so now we're getting even into the digestive tract. I don't want to dive too far into the weeds, but again, that's something important to look at. We can get it through different fungi and different type of mycotoxins or mold species. So there's several ways that we can this vector can be transmitted to us and affect us. So something to be aware of. And then also that when we're treating these various pathogens, that we will get something called a Herxheimer reaction. For those who watch my content, they're very familiar with a Herxing reaction, or also known as a die-off reaction, which can exacerbate the symptoms and honestly make you feel worse before we get better. But I always tell my patients, it's okay that we're feeling worse. There's some remedies and some things that we can do to help that, but but it's a good sign. The only sign you don't want is everything has stayed status quo, right? And Herxheimer reaction can represent itself as, increased fever, increased swelling, increased joint pain, increased brain fog, further sleep disturbance. So there is a wide array of herxing that can occur when treating these various pathogens. And then again, I just wanted to mention Dr. Thomas Brown here, who brought this awareness to a potential pathogen causing this. And this book, The Road Back, has a lot of good information on that. So how to help the immune system? That's the key aspect here. How do we control the immune system? How do we help work to influence the immune system? So number one here, crucial, needs to be done first and foremost, is proper nutrition, right? Proper nutrition. And for these patients, you're looking, typically for my patients, I'll say somewhere between 6 to 12 weeks, but we're probably looking at longer periods of time for that to regulate the immune system with an autoimmune reaction. And I typically recommend an AIP diet, so an autoimmune paleo template, which focuses on removing sugars, removing inflammatory and highly processed foods, and really focusing on meats, good healthy meats, vegetables, moderate fruit, because we'll talk, fructose is a high form of sugar that can drive increase in sugar. And if we have an increase in sugar, we're going to drive insulin, and insulin can further stimulate the immune system as well. So we want to try to keep our sugar low. So moderate fruit consumption. For patients who are really struggling, I would say 2 to 3 servings a day. And I would consider a serving like if you grab, a handful of berries, that would be, a rough guesstimate of a serving. Okay, so 2 to 3, no more than 3. Even that's probably pushing it a little bit a day. But being aware of that. So again, we go good meats, good solid veggies, color of the rainbow veggies, moderate fruit consumption, sweet potato, and coconut and avocado. That's basically what the AIP diet consists of. I know it seems pretty extreme, but typically we'll have you meet with Carrie, our nutritionist, who's fantastic, who does a great job making this a little bit more doable. But it is a bland diet, and I do tell my patients this is food prison. But it's necessary to move forward in preventing the progression of this condition. Also, using good, adequate exercise. Again, how we talked about movement is very helpful for rheumatoid arthritis and helpful for other arthropathies as well. A common, we just need to be careful because too much exercise can, cause us to backstep. So typically, if you're having joint pain or increased joint pain 1 to 2 hours post-exercise, probably an indication that we exercised a little bit too much. First, I'd recommend doing, low, gentle stretching, yoga, body flow, other types of movements that just help to move joints, really, really helpful. Recumbent bike exercising. If you have access to, water, to a pool and have water dynamics, that would be awesome, very, very crucial. But if you can't, then just again yoga, simple stretching, and working your way up. There's some good research into a phase 8 exercise, which basically is just 8 cycles of high intensity training for 30 seconds. So like a 30-second sprint with a 90-second jog or walk, and you're producing that 8 times or reproducing that 8 times. That seems to be really effective in helping increase that synovial production. And then something that we don't talk about as much is managing stress and trauma. So another aspect, we talked about the potential exposure to a pathogen, being the excuse me, I heard a noise in the background. It's the printer. Coming back to what triggered the immune system. Now, it can be a pathogen, but also we'll see an extreme stressful event that can trigger that immune system. So making sure we're addressing stress and trauma, whether it be through meditation, whether it be through scripture, whether it be through art or music or exercise, finding a really healthy modality to help manage stress. Using good omega-3s, DHA, EPA, helping to down-regulate that inflammation, really, really important. Gamma GLA is super helpful here, which is gamma linoleic acid. Gamma linoleic acid, about 2.6 grams per day seems to be the therapeutic dose, which helps to downregulate some of those pro-inflammatory cytokines, the prostaglandins, and the leukotrienes that we mentioned earlier. Astaxanthin, really helpful in helping several things. So fish oil can tend to rancidify. It's making sure, really important, you're getting a really good quality source. And I here at Turnpaugh Health and Wellness, I know Dr. T has done a really good job with sourcing and actually going to the manufacturers and going to the factories where they're processed to assess the quality and purity. So, one, making sure you're having a really good omega, but astaxanthin does help with the preventing the oxidation if you are taking rancidified fish oil, so prevents the further inflammation. Also, astaxanthin has been really helpful to show the reduction in age-related macular degeneration, cataracts, even like burns, like sunburns, is helpful, and also to negate some of the negative side effects that we talked about earlier of prednisone. So really helpful. Again, crucial vitamin D, making sure you're getting adequate vitamin D. And there has been a lot of research with using DHEA, that's dihydroepiandrosterone, with the prevention of joint pain, right? And then again, here's some links here that you can copy and paste, or just put into the web search to get some research behind this as well. Next, we wanted to talk about to continue on with this. So we talked about, again, that this is just a recap. Rheumatoid arthritis, it may be just that it is from a bacteria or a virus, so making sure you're addressing that and doing testing. That medical diagnostic laboratory, we're assessing circulating antibodies. And we want to just mention here that now this isn't something that you're going to reverse completely, right? Hopefully this plan and our approach is to stop the further progression of this disease. Once we have an autoimmune condition, unfortunately, we are stuck with that autoimmune condition for the remainder of our life. So again, coming back to the nutrition, making sure that that we are staying on this nutrition. Now, as you further progress towards remission, you might be able to get a little bit of leeway in with what you're eating, get away with certain things that you might not have at the start of this condition, but always having a focus on the nutritional aspect. Then we want to, again, the goal is to stop the progression and prevent the further progression of this disease. So we talked about those omega-3 fatty acids. So there is some difficulty with the absorption of omega-3 fatty acids. There is several steps that needs to be done in order to break down and absorb those the DHA and EPA. So typically the EPA and DHA is attached to a triglyceride, which is a fatty backbone, and that's how it is delivered, and it travels into the bloodstream. But what happens is we need to cleave that triglyceride, and typically once that triglyceride is now cleaved or broken down, it will then travel to the liver. But that's why if we get a lot of belching or regurgitation of the fatty acid, we're probably having some digestive impairment. We need to, again, look at the gut and look at how well you're releasing your enzymes and the pH of your gut. But again, once it gets delivered to the liver, it now needs to attach a phosphate for it to be absorbed, either a phosphatidylcholine or phosphatidylserine, in this case, for it to be absorbed. So another aspect to be aware of is, maybe taking some phoscholine with the plan here would be helpful. Krill oil already has phosphatidylcholine attached to it, so it can increase and improve the absorption rate of the EPA DHA. So that's something to be aware of. We talked about astaxanthin and all of the positive effects. Again, the reduction in oxidation, the prevention or mitigation of the side effects of prednisone, and the helpful effects for our skin and our eyes with this. So about 4 milligrams a day. We also talked about the gamma-linolenic acid and its prevention of oxidation and downregulating the free radicals or the pro-inflammatory cytokines. Again, the purpose of addressing and at least acknowledging the emotional trauma and stress that comes with this. We talked about reducing herxing, the herxing reaction, if there is a pathogen that we need to address. Usually I'll use like glutathione, which is very helpful, N-acetylcysteine, alpha-lipoic acid. Those are really good aspects to help with the prevention of the herxing reaction. And then exercise has been shown to reduce the herxing reaction. Again, vitamin D, we want roughly around 80 nanograms per milliliter. Usually vitamin D can vary anywhere from as little as 1,000 international units a day up to 20,000 international units a day. So getting blood work done, assessing where your vitamin D blood levels are at, and dosing that appropriately. And then talking about, again, the infectious component of it, usually we'll use various herbs, whether it's echinacea, golden seal, whether it's grapeseed extract, whether it's black walnut, red root, sarsaparilla, various antimicrobials and antibacterials that are really helpful. And of course, you can get into the medication route as well. But our goal here is to try to see if we can address this naturally, or at least support this condition here. Our goal really is to support this condition, support your immune system naturally. But if needed, there are some aspects that we can address from a allopathic standpoint or a prescriptive standpoint. Those are the key aspects. And again, focusing on nutrition, good, healthy nutrition, gluten-free, trying to stay away from some dairy, keeping low sugar intake, making sure that we have high, good, healthy fats, that we are not eating conventionally farmed meat, trying to eat grass-fed, grass-finished meat, cage-free, antibiotic-free poultry, and wild-caught fish are really important. And then good, healthy, color of the rainbow vegetables, and making sure, again, getting those healthy fats are crucial. Very, very important. Again, this was, I know, a long-winded version. I wanted to give you some actionable items, some actionable details here, which I hope I have. If you are concerned about rheumatoid arthritis or other arthropathies here, or other arthritic conditions, please don't hesitate to reach out to the office. If you want to share this with someone who may benefit, please, that's my goal, is to reach the masses and be able to help as many people as we possibly can. And I appreciate your time. If you have any questions, please don't hesitate to reach out to the office. You can go to www.turnpaughhwc.com, or you can call either one of our offices The Mechanicsburg office is 717-795-9566. The Mannheim office is 717-879-9899. We have a plethora of amazing practitioners who are all extremely confident in addressing, in supporting the immune system and supporting this condition here. I appreciate your time, and again, share this information with anyone that may benefit. And thank you for your time, and have a great day.